Hi, I'm Dr. Harry Schick. I've been in practice for 35 years, and I want to welcome you to our website for thyroid disorders. I want to congratulate you on being here and watching the videos. And I want to tell you, when patients come in, they want to know two basic things. One, how did I get this way? And secondly, is there anything that can be done? Well, you're not going to get all of those answers here, but after this you'll have the opportunity to watch our full-length video where those answers are. You're also going to find out what's next and what you can do about it. Look, if you have a thyroid problem, I know that you've been suffering for a while. And that suffering with thyroid can come in many different forms. You could have brittle hair, be overweight, fatigued, cold hands, extremities, and so forth. The issue is that thyroid receptors are found all over the body. So a thyroid problem can cause almost anything. Now there's a world of difference, folks, between how we do things here and what's done in a traditional medical practice, where they deal predominantly with emergency care and with medication. Here we're going to investigate and find out why you have the problem that you have, and more importantly, what can be done about it. Now you're not going to hear this elsewhere. Now, you probably have already tried a lot before coming here, before watching this, but I want you to watch the full-length video afterwards, and you're going to learn more about what underlying causes there are for thyroid disorders and what can be done. You just have to ask yourself, is this the way I want to live the rest of my life? And see if you want to find something new that can help you. And if you do, you look around the website, you'll find testimonials of people like you and how they got help. I'm Dr. Harry Schick. I hope to see you soon. Hi, I want to welcome you today. We're going to have a good time. We're going to learn a lot. We're going to be talking about issues that will be very important to you and people who you love. It's an introduction to metabolic balancing and functional neurology, which is a lot of words that now may not make much sense, but by the time we're done, it's going to be very clear for you. I'm Dr. Harry Schick. I've been in practice for 34 years. I've written 3 books, but the important thing is about you, because now is the time to get information so that you can make changes that you need to make in your life. So the time is now. We're together, so let's get started. We're going to talk today about 3 basic things. Number 1, we're going to talk about healthcare, a little introduction in general, so that it makes sense what we're going to do after that. We're going to talk and spend most of the time, of course, talking about your thyroid. And then we're going to talk about what you can do to make things better. You know, typically, the health profession and the medical profession was trained and very good at handling acute care. Like someone is in an accident, someone falls, someone is cut. The medical establishment is phenomenal, and the only place that I would want to be if I had an injury of that type. The majority of remedies, of course, are medication in this kind of an acute, severe emergency situation. But we need to discuss the difference between an acute situation and a chronic situation. Because if you're watching this, chances are you are not having an acute problem. It can be severe, and a lot of people confuse acute and severe. You can have a chronic problem which is severe. Chronic means it's been going on for a while. It didn't just start yesterday. So let's say you're driving down the street and you're looking over your windshield, and all of a sudden you notice that on your dashboard the red light shines on your dash, telling you what? That there's a problem somewhere. Is the problem on your dashboard? No, it's not a dashboard problem. It's a problem somewhere deeper in the car. Now, I don't know a lot about cars, but I know enough that if there's a light on my dashboard, I better do something about it. So if you have a chronic problem, it's like a light on your dashboard telling you something needs to be done. Now, it doesn't point to exactly what needs to happen, but we know something needs to go on. Generally, the problem somewhere inside can have to do with your nerves, can have to do with blood sugar, can have to do with hormones, can have to do with cortisol. It can be any number of places. And by the time we're done today, you're going to understand a lot about this, and this will make a lot of sense for you. Now, we've got acute care. We're leaving that behind because this is not about somebody who has a sudden injury, which is about a chronic problem that you've had for a while. Now, interestingly, although chronic problems show up in a number of different ways, it can be your thyroid, it can be your liver, it can be your digestion, it can be your joints. There's a lot of different types of chronic problems you can have, but underneath all of those symptoms, underneath all those lights on the dashboard, we know that there's two basic things we need to look at. Your body chemistry, what's going on with your metabolic system and your body chemistry system, and your nerves. Because behind every chronic problem, thyroid, pancreas, spleen, no matter what it is, Crohn's disease, peripheral neuropathy, some combination of a chemical issue and a neurological issue is at play. And that's what we're going to talk about. So anybody who has a chronic issue has to be evaluated on these two ways, right? Number one, what's going on metabolically or in terms of body chemistry and in terms of your nervous system. Now, I just said that 3 times, and the reason I repeated it 3 times is because it's such a different type of a way of looking at things, and in order for this all to make sense, we have to leave one model of understanding behind and open up to understand what's going on now. So, that's our healthcare talk. That was part 1. Difference between acute and chronic care. Now, let's get into the meat and potatoes of what we're going to talk about. Let's talk about your thyroid. So your thyroid gland is located in your throat. You probably knew that. And it's a small gland. Interestingly, it comes from the Greek word meaning shield. Because really your thyroid gland does shield you when it's working well. It shields you beautifully from a lot of potential problems. But when your shield is down, when the thyroid's not working well, it opens you up to a lot of issues. So the thyroid supports and is involved with bone metabolism. It's involved with your immune system, your nervous system, your hormonal system. The thyroid interplays with almost everything, reproductive system, everything. Why is that? Why is such a small gland over here involved with every other part of your body, basically? Because every cell in your body has thyroid receptors. That's something most people don't know. So I want you to think about that. I want you to get this. Every cell in your body has thyroid receptors, meaning that when your thyroid sends out hormones, or if it doesn't send out hormones, it can affect every other cell. That's why when we put up a list of thyroid symptoms, it seems amazing. How can one person have a thyroid problem where they can't sleep and they're overweight? Another person, their weight is fine, but their hands are cold. Another person has thinning hair. Another person has anxiety. Another person gets up in the morning and has no get up and go. They have no impetus to do anything. One person falls asleep at night easily, but then wakes up in the middle of the night, can't get back to sleep. Another person tosses and turns. Once they sleep through the night. How is it possible that all these different thyroid symptoms can be from the same issue? Because remember, every cell of your body has thyroid receptors, and depending which cells are not receiving the message, that's where your symptoms can be. Whether it's poor circulation, muscle spasms, constipation, the things we mentioned before, anything can be possible with that. Now, the thyroid and how it works through the body is complicated. You can see on this diagram in back of me, which we're going to touch on some of it, but this is only a part of the intricacies and complications of your thyroid. It starts up in your brain, works down through your body. The messages from your brain going to every cell in your body has to go through some combination of these things, plus interplays with other parts of your body. But let's just talk about the basics. Okay, so the basics is that in your brain, a message goes that says, hey, I need more thyroid hormone in the body. So think of your brain like an inventory clerk. Your body looks around and says, hey, what's missing? What do I need? Do I need more of anything? It says, wait, you need more thyroid hormone. So your clerk, called the hypothalamus, tells your pituitary gland, let's get more thyroid hormone going. But your pituitary does not make the thyroid hormone. It sends a message to your thyroid and says, let's get more. We need more. There's a lack in the body. Okay. So that we got those 2 points. The brain, 2 parts of the brain tell your thyroid what to do. Now listen to this. The thyroid releases T4. You've probably heard of that if you've got a thyroid problem. You probably have been exposed to that idea. And T3. 94% of what your body makes, 94% is made of T4. And your body only makes a little bit of T3, which is interesting because T3 is actually the hormone that does the job. T4 is like a storage hormone. It doesn't work. So your body actually makes much more storage hormone than active. Well, we're going to get into this, believe me. You're beginning to get the intricacies though. Now, these hormones don't just get riding around in your bloodstream, they have to go in what are called little taxi cabs. Thyroid binding globulin carries the thyroid throughout the body. So, once that, remember I said the storage form is T4, and once that T4 gets in your body, it has to be changed into T3. Think of it like this. By the way, the difference between T4 and T3, T4 has 4 iodine molecules, T3 has 3. So T4 think of as being too big to fit into your cell to do anything. So your body has to cut off one of the iodines, which changes T4 to T3, and now that can get into the cell and do the job. The majority of that, 60% of that happens in the liver. So inside the liver there's a little area where T4 is changed to T3. About 20% happens in the intestines, and the rest of it happens in different parts of the body. So your thyroid can be doing what it needs to do. It can be sending out all the hormone it needs to send out. But if those other stations are not doing the job and changing T4 to T3, you're going to have symptoms. You're going to feel miserable. Think of it like this. If you want coffee, these are the coffee beans. This is T4. This is what makes the active form of it. So your body sends out coffee beans all over the body, but in the liver and in the gut and other areas, it makes the coffee for your body to use and drink. So if we're only looking at the coffee beans, you're not going to get anywhere. We have to see where the conversion is from one to the other. Looks good, doesn't it? Okay, so we know that we have an issue because you're watching this and listening to this. We know that something is off. And I mentioned that there's 2 ways that we look at things, metabolically or chemically and in terms of your nervous system. So let's see, how do we assess you metabolically? How do we figure out what's going wrong? Well, the most common way is with blood tests. Now, that's not all we do. To figure out what's going on metabolically, we can do saliva testing, stool testing. There's other things we do also. But the majority of it, and what you are most likely used to, is blood work. So, now here's my question for you. Have you been told your lab tests are all normal? And I see this all the time in the office. People come in and I ask them to see their blood work and they say, oh, don't bother looking at it, it's all normal. So yeah, if it's all normal, how come you feel miserable? So there's 2 reasons why you may have been told that your blood work is normal, but you still have problems. Number 1, the lab ranges that are used may be inaccurate, and we're going to talk about that in a minute. Or maybe there was only minimal testing done, which we're also going to get into. So it's not necessarily something wrong with you. If somebody says, listen, your blood work is normal, I don't know what the problem is, and then they want to give you a prescription for Prozac or something to calm you down, when you know inside something is off. And I'm going to show you what the problem is. We have something called a lab range and a functional range. Now, listen. When you get a blood test done, it shows your value, and then it shows you whether you fall within a normal range or not. Am I right? You've seen that. Where do they get that normal range from? Did you ever ask yourself that? I mean, they're comparing you to a normal range. Where did that normal range come from? I'll tell you. That normal range is based on an average, get this, an average of blood tests that were done over the last few years. So who goes get blood work usually? Who's a normal person? If you go to a lab and you look around, who's in there? Maybe a couple of people who are feeling good and they're there for their yearly checkup, but the majority of people are sick, not feeling well, and on medication. That's who you're being compared to. So when they tell you that your blood work looks good, it means it looks as good as a room full of sick people. That's not quite good enough for me, and it shouldn't be good enough for you. We look at functional lab ranges. Is your blood work good enough for your body? Now, I've been in practice for 34 years, and I have seen blood levels change, the actual reference range change over those 34 years. How is that possible? People haven't changed in 34 years. It's because as people get sicker and sicker, the range of what's normal gets greater. Are you with me? So, you can have abnormal low values here, abnormal high values here, and being told you're fine. But if you're in here, you're not good enough, and you're not going to feel good. Let me give you an example. Okay, so maybe you're told all your tests were normal. Let's look at TSH. TSH is thyroid stimulating hormone. We're going to talk about this more in a minute. According to traditional ranges, It can be anywhere from 0.3 to 5.7, right? So if you fall between 0.3 and 5.7, you may have been told, hey, everything is normal. But that's not functional for you. That doesn't work for you. So if you have 4.2, you may be told, hey, everything is normal. But look over here. Here's the functional range, 1.8 to 3. So if you're at 4.2, you're going to look normal for the reference range of the lab, but it's not good enough. It's not right. You're functionally off. You're just as good as your neighbors. So that's problem one. The way your test was assessed could be based just on a too big of a reference range. Problem number two, maybe you didn't have all the tests done that you were supposed to have done. Right? And here's a list of a complete thyroid panel. Most people, when they come to me, don't have this. They don't bring this to me. So let's go back in time a moment. Remember this? If you're old enough to remember this, this is what telephone. Now you probably don't have a telephone like this in your house, unless it's ornamental. You probably have a telephone, more likely to have a telephone in your pocket than have one of these in your house. Let's take another step back. For those of you who are old enough to remember, there used to be something called mimeograph machines. If you wanted to make a copy, there was no such thing as going to a copier or a Xerox machine. You had to go make dittos or masters on a mimeograph machine. So times have really changed, haven't they? Right? These are ways in which things were done maybe 40 years ago. Now, typical thyroid test, which is ordered, is what? TSH and T4. And that's probably what you've had done. This is a model from the time of that telephone and that mimeograph machine. If you're only looking at this, you're looking at a small part of the picture, which is what people used to recommend years and years ago. Let me ask you, how are you going to manage your health without all of the information? The answer is not well, right? In order to manage your health, we have to look at everything. Not just your symptoms, but what's really going on. Okay, that's part one. Stick with me now, because now we're going to get into something which is crucial for you. We're going to look at the 6 major thyroid patterns. That's right. If you have a thyroid issue, a thyroid problem, chances are your problem falls into one of these 6 patterns. There are others, but the majority of people fall in here. And I want to go over each of them with you briefly so you can get a sense of what has to be done to really figure out why you're not feeling well. Because if you're watching this, chances are you or the person next to you or somebody you're concerned about isn't feeling well. And as we said, the thyroid symptoms can be brittle hair, constipation, fatigue. Fatigue's a big one, right? Sluggishness all the time. Can't get out of bed in the morning. When you get up, have no energy to do anything. Chronic overweight, can't lose belly fat. Whatever it is, the thyroid receptors are everywhere. So let's look at the 6 basic patterns of what can go wrong. The first one is called primary hypothyroidism. Okay, this is the basic one, primary, that's why it's called primary, hypothyroidism. Hypo means under or less than. This means your thyroid is not working well. Why not? Because it's lazy. It's just not doing its job. Whatever the reason is, it's just sluggish. So, your pituitary gland, remember, is in charge of telling your thyroid what to do. So it starts telling it what to do, and it goes louder and louder. Because let me ask you a question. If you had a conversation with somebody who you wanted to do something, and they were in a situation where they were supposed to listen to you, like you were their boss, for example, and they didn't follow your instructions, what would you do? You'd tell them again. And maybe you would start to yell after a while. And that's basically what your pituitary gland does to your thyroid. It starts to yell. Now, how does it yell? It yells by sending more and more messages. That message is called TSH, thyroid stimulating hormone. So if your TSH is high, that means that your thyroid is sluggish and your pituitary is yelling at it, just like this guy's yelling at this guy. Hey, get to work, thyroid, let's do its job. Now, if you have this, and you're on some kind of thyroid medication, chances are that fixed your problem, because thyroid medication will help a person in category number 1 feel much better. Right? So chances are, if that happened, you're not listening to this because you're feeling good. The medication helped you. If you've been on medication and it didn't help you, chances are you don't have this, because medication helps people feel better when they have simply number 1 and nothing else going on. So let's go into the other ones, because that's probably, we're going to find you over there. Number 2 is hypothyroidism, which is secondary to the pituitary not doing its job. Okay, so here we got a situation where the thyroid is willing to work, but the pituitary is not telling it what to do. So in this case, we have to get the boss working better. We have to get the pituitary speaking more, doing more, talking better. And this is done potentially with different nutritional things, other things we'll talk about later. I just want you to get the difference now. The first one, the thyroid is being told what to do, isn't listening. The second one, the pituitary is not telling the thyroid what to do. So it's really hypopituitary function. And this can happen often due to different stresses, hormonal issues, postpartum depression, blood sugar issues. There's a lot of reasons why that can happen, and there's a lot of things to be done for it, but what I want you to get now is what it is. Okay, so number 1, sluggish thyroid. Number 2, sluggish pituitary. Now, remember the picture I showed you before where there was lots of coffee beans, right? But no coffee, or not enough coffee. And this was an example where your body was sending out lots of T4, but it wasn't making it into T3. So the 4 iodines can't fit into the cell. So your body is not making the 3. So your blood looks great. You got a lot of T4, but it's not getting into the cell because it's not being converted to T3. So category number 3 is called thyroid underconversion, where the thyroid hormones are not being converted from T4 to T3. And if you remember back, most of it happens in the liver, some in the gut, and other areas. So if we're not looking completely at you to see if there's potentially a liver issue, a liver sluggishness, a digestive issue, this is where it gets complicated, because a thyroid problem can cause a digestive issue, and a digestive issue can cause a thyroid problem. So you see here we go round and round. We have to know exactly where we're going to intercede for the make a benefit for you. So that's category 3. 1, thyroid sluggish. 2, pituitary sluggish. 3, the thyroid is not converting enough T4 to T3, so you've got all these coffee beans, but it's not doing you any good. Let's look at number 4, thyroid overconversion. Now you've got too much T3. You've got too much active thyroid. Are you with me? Now, this seems like, what's the problem, right? I want to have T3. What's the problem? So let's say you have a neighbor, and the neighbor comes, knocks at your door. I want to borrow something. Hey, fine, you open the door, loan them something. Let's say they come back like 10 minutes later, knocking at the door. What is it? Oh, something else? Okay, fine. Let's say they come back 5 minutes later, knocking. How many times do they have to knock on the door before you don't feel like opening the door anymore? 2, 3, 4, 5, 10, 15. Eventually, you're going to be hesitant to open the door. Am I right? So that's what happens when there's too much T3 knocking at the door of your cell. Eventually, your body will not want to open that door and not allow T3 in, even though it needs it. It's just worn out from opening that door. And why does that happen? Cells are not listening. Usually blood sugar is involved, hormones are involved, but this is what we have to investigate to find out what's going on. So that's issue number 4. I like reviewing. You notice that? Thyroid is sluggish. Pituitary is sluggish. You're not making T4 into T3. Too much T3. Now remember back, we were talking about the fact, way back a number of slides ago, we're talking about the fact that T4 and T3 don't just go around your body by themselves. They have to be carried. So they get carried a little, we call them taxi cabs. It's a thyroid binding globulin, but they carry, it's a protein that carries the T4 to where it needs to go, and then it carries the T3 to your cell. They're little carriers going all throughout your body. If you could see them, you see, like, imagine little taxi cabs all over your body. Now there's a problem. The next problem is we have too many taxi cabs. What could be a problem with too many cabs? So let's think about this. You won the lottery, or you won a prize, let's say, and you got tickets to go see your favorite show. You've been dying to see the Book of Mormon, or a drama, or whatever, something hard to get tickets, Lion King, whatever it is. Finally, you get the chauffeur-driven car takes you, or the taxi cab, let's say, picks you up at your door. It was a good prize you won, takes you right to the theater, and opens the door, and you get out of the cab, and as you get out of the cab, another taxi picks you up and whisks you away. You didn't get to see the show. But it lets you off somewhere else, and another cab picks you up and takes you away. And that's what happens in your body. The thyroid hormone gets delivered to the cell, but because there's so many cabs, between the time it gets from the cab into the cell, it gets whisked away. So that's also a problem. Too much thyroid binding globulin. Again, hormonal issues, blood sugar issues, and the like will create problems like this. You're beginning to get the picture. We're not just looking at TSH and T4. We have a lot to look at if you're going to get better. So that's number 5. Come, review with me. Sluggish thyroid. 1, 2 is pituitary. 3 is a lack of conversion from T4 to T3. 4 is too much T3 knocking on the door. And 5 is too many taxi cabs. So how many did we say? We said there were 6. Okay, now 6 is the big one. And 6 you can have in combination with the others, but if 6 is not handled properly, all bets are off. You're not getting better. Number 6 is an autoimmune problem called Hashimoto's syndrome. Now this, by the way, technically is not a thyroid problem. That's right. Hashimoto's syndrome is really not a thyroid problem. It affects your thyroid, but it is not a thyroid problem. So let's say you have you're looking outside and you see somebody with a baseball bat hitting somebody else in the head with a bat. Gently, we don't want to make anything too violent. They're hitting somebody in the head. So let me ask you a question. Is it a bat problem or is it a head problem? Obviously the problem is not their head. The head is where they're getting hit. The problem is that there's a bat hitting them in the head. So what do we want to do in this situation? Do we want to put a helmet on their head, or do we want to take away the bat? Obviously we want to take away the bat. So Hashimoto's syndrome is where your body begins to attack itself. It hammers away, it slugs at your thyroid. So what we want to do is we want to stop it from hitting it. Okay, we want to stop the autoimmune assault. Now, an autoimmune problem is where your body attacks itself. And there are many autoimmune problems that can happen. When it happens to the thyroid, it's called Hashimoto's. But if the same thing happens, and instead of hitting your thyroid, it attacks a part of your intestines, it may be called Crohn's disease. Or if it attacks your myelin sheath, it may be called multiple sclerosis. Or if it affects the substantia nigra in your basal ganglia, it may be called Parkinson's. Wherever it is hitting, it is named based on the target. So what's essential to do is to find out why it's doing that. In an autoimmune problem, you've got a gun pointed at an area and it's loaded. So we can't put the gun down and we can't take the bullets out of the gun, but we want to find out what's making it pull the trigger. Because as long as it's not pulling the trigger, you're not going to have the problem. So the way the immune system works is that there's 2 sides to the immune system. Very simply, there's one side called Th1 and one side called Th2. Th1 is the side that fires away, like I just showed you, at different parts of the body. Th2 is the area that kind of shows, it's like the deputy showing the gunslinger where to fire. So you got a gunslinger looking around wanting to fire and shoot. And you have the Th2 side saying, hey, it's over there, hey, it's over there. So if the Th2 side says, hey, the thyroid is bad, it'll fire at that area. Or, once it fires at that area, whenever it gets told to shoot, it's going to shoot there. So let me ask you a question. Why would your immune system do this to you? Why would you attack yourself? What would make it do this? Doesn't make sense. We know the immune system is important. Obviously, we'd be dead without it. It has to fight bacteria, it has to fight viruses, parasites, and so forth. But why would it attack you? What would trigger your immune system to do this? So once this system gets in place, foods that you eat, different vitamin imbalances, hormone imbalances, adrenal gland imbalances, viruses, parasites, all of these things can cause your immune system to fire. So the only way to know what to do is with proper testing. I think you're getting the idea. We went through the 6 stages, so 6 different categories. And I think you can see now that if you don't do the proper testing, we're not going to know what's going on. When you take your car to a mechanic, you want somebody who just closes their eyes and does whatever they feel like, or you want somebody who's going to analyze the situation. How about for your body? Don't we need to do that? Don't we need to analyze exactly what's going on? I always tell my patients, The more I know exactly what's going on, the better chance it is that I'm going to be able to help you. Does that make sense? The more I know exactly what's happening, the better the chances are of you getting better. Simple. So thyroid dysfunction is a sign of something going on, number one, metabolically, right? And I've mentioned many examples. It can be anemias, it can be liver congestion, it can be vitamin D issues, it can be estrogen, progesterone problems, it can be a food issue, gluten, soy, eggs, dairy, who knows? One person in one room with a thyroid problem can have one set of symptoms: constipated, bloating, overweight, lethargic, and they have one reason for that. Another person in the next room can have the exact same symptoms, but for a different reason. A person in the next room can have cold hands and brittle hair and losing their hair, and they can't sleep at night for a whole other reason. We have to know what's going on metabolically in order to get anywhere. And we do the testing. We do the testing to find out what's going on. Okay. Mention that there's two basic ways in which we're going to see what's going on with your thyroid. Number one was metabolically, your blood chemistry, and that's what we've been talking about. Number two, your nerves. What about your nervous system? How important and how does your nervous system fit into this thing with your thyroid? Okay, so let's see. The nervous system is made up of the brain, spinal cords of the nerves, and we need a proper functioning nervous system for your thyroid to function properly. Okay, there's a thyroid-brain connection. If your brain and your nervous system is not telling your thyroid what to do at the proper time, in the proper way, things aren't going to work. And there's a couple different connections that you have for the nervous system connect in. One is with the vagus nerve, other is with spinal nerves. The key is knowing what's going on, and if there's something wrong, which usually there is, we have to make the correction metabolically and neurologically. So, when we assess what's going on with your nervous system, we look at four basic categories of potential problem. Number one, abnormal sensation. Do you have tingling, or do you feel extreme sensitivity to cold? Do you not feel your feet when you walk? How about abnormal movement? Do you have a tic or spasming going on, things of that nature? Abnormal cognition. Is there a thinking issue? Do you walk into a room and forget why you're there? Do you often not remember people's names? You can't remember phone numbers? You can't plan things well? You get confused easily? These are all signs of nervous system issues. And then abnormal posture, because part of your nervous system is designed to hold your posture intact. So if you have a problem in any one of these four areas, chances are there is a neurological issue going on with your thyroid. But let's look at the brain system a little differently. The cerebellum, which is in the back of the brain, is the most active area in your brain. So how do you know if you have a problem there? Well, if you're clumsy, if you tend to trip over things, neck and back pain, dizziness, visual disturbances, if your vision isn't as good as it used to be, if you get dizzy when you look in a certain area, all issues potentially with the cerebellum. Two other areas we need to look at. Your sympathetic nervous system, which is your fight or flight system. You know, you're walking across the street, calmly holding someone's hands, having the time of your life. It's a beautiful day, not snowing, wonderful day. And all of a sudden a car starts coming at you and you jump. That's your sympathetic nervous system, your fight or flight system. If that's off, it can affect your thyroid. The other is the limbic system, emotions. If the limbic system is overly sensitive or is misfiring, it can also affect your thyroid. How do you know if you have a sympathetic imbalance? Well, we check you, but here are some things you may see. Headaches, overly sensitive to light and sound, high blood pressure, poor digestion. Do you wake up during the night having to go to the bathroom? Problems with sleep, chronic pain, all potential problems of sympathetic nervous system imbalance. How about with a limbic problem? We call limbic escape. Irritability, lack of focus, anxiety, OCD, things of this nature. If you have this, there's a limbic problem, which again will be affecting your thyroid. How do we get in this mess? I mean, you're beginning to see how complicated this is, and why just take this pill is not the answer. Chemical stress affects the nervous system. Things that you eat, toxins, excitotoxins, bad food. You know, I like to say, people say, well, I eat a little bit of junk food. I say, junk food, there's no such thing. It's either junk or it's food. So if you're eating junk, it affects it. Physical stress, problems that you may have had from a fall or some kind of an injury, emotional stress, mental stress, constant worrying, anxiety, all these things cause the brain to fatigue. When your brain fatigues, there's less frequency of firing and less neurological input going to your thyroid. We have all kinds of chemical and physical stresses going on to your nervous system. Anemia, blood sugar problems, food sensitivities, all the things we've talked about, all lead to hypothyroid functioning. So, what has to happen? Just like we have to do comprehensive blood work and maybe saliva testing and so forth, we need to do comprehensive neurological workup. Why? Because your nervous system is involved in your thyroid firing. You can have a beautiful metabolic system, perfect blood chemistry, and problems neurologically, you're going to have a thyroid problem, and I've seen it. So we do all these neurological tests. There's actually many more. I just wanted to show you how comprehensive we get. We do gait testing, we test your cerebellum, we do sensitivity testing for your sensation, we do movement tests, heart rate variability, which gives us an idea about the differences between your sympathetic and parasympathetic system. We do eye tests, we do reflexes. Basically, we do everything. Why? Because if we miss something, you're going to be missing something, and if you're going to be missing something, you're not going to be happy. So if we find a problem, what can be done? Brain-based therapy. The brain is just like a muscle. You may have heard the term neuroplasticity. It means that your brain can grow, can be healed, things can get fixed. But we have to know what's wrong first, right? Okay. So the cerebellum and the brain require two basic things to work: the proper fuel, a proper blood sugar level and oxygen, and activation. And activation is, we find that if your brain has proper activation by doing the nerve testing I just spoke about. And then if we find a problem, we have a wide array of things that we do to help, different types of exercises, light stimulation, different types of hearing stimulation, olfactory. We use a metronome, which helps your brain timing. We do rhythm and timing exercises. We probably have 50 things we do. I put a few things up here because I want you to understand how comprehensive things have to be. Comprehensive in two ways, metabolically and neurologically. So now I'll ask you a question which should be obvious. What makes our office different? We look at things neurologically and metabolically in order to help your thyroid symptoms. We have to know everything that's going on, or else you won't get the care, you won't get the results that you're looking for. If you're watching this, you're watching this long, you're looking for results, and that's what we want also. We manage and support patients neurologically and metabolically. No stone is left unturned. We keep digging. Now remember I showed you this picture in the beginning where things were all over the place. Our job, my job, is to put things together into a nice puzzle, put it together to explain to you what's going on. Don't you deserve to know why you're feeling the way you feel? Of course you do. And you're beginning to see that only through proper testing and looking at everything are you going to find out what's going on. How do we fix something if we don't know what's going on? It's kind of a rhetorical question. I'm actually asking you that. How do we fix something without knowing what's going on? The answer is, we don't. So, that was part 2 about your thyroid. First we spoke about healthcare, the acute model versus the chronic model. We're in the chronic model here. You don't need to go through all this stuff if somebody breaks their leg. You just got to fix them. But if somebody's got a chronic problem they've had for a long time, you better find out what's going on behind the scenes. Because your body is always trying to heal itself. If it has not been able to heal itself, we want to know why. Now we go into part 3. Part 3 is, what are you going to do? Well, I hope you've enjoyed this and I hope you've learned a lot, but really it's not going to do you much good unless you do something about it. So the next step is action. And here's my phone number, 732-249-9800. I'm in Highland Park, which is in central New Jersey. And if you don't make the call, you don't do something about it, and I'm going to explain what we do in a moment, but you have to get into your head that if you're serious about getting better, you have to take action, and probably different action than what you've been doing. So what happens if you come to my office? What am I going to do with you? So let's just look at the first 2 visits, because this is probably different than what you're used to. Number 1, a complete neurological examination. We've spoken about all that goes into that. You're getting that. review of your existing labs. I'm going to ask you to bring your labs in when you come, and we're going to look at it. We're going to analyze the tests that you had done functionally, not just based on laboratory values, and we're going to find out if you need more tests. My experience is chances are you do, but we're going to look at it and discuss that. You're going to fill out 2 forms that I give you that are very specific questionnaires that help me get to the bottom of what's going on in combination with other things. And the 4th thing is you must bring your spouse or significant other. Why am I insistent on that? Okay, let's say you came and we did all these tests, and you spent time here and you got here and all the energy to do this, and you go home. What are they going to ask you? So what happened? Are you going to be able to explain all the stuff that we did? I don't think so. So I want whoever you're going to discuss things with here so that I can explain to them while I'm explaining to you what's going on. Makes sense, right? Second visit. So you come back, a case review, if I accept your case. So by this time, after the first part, I'll know whether or not I want to work with you. I'll know whether or not I feel like I can help you. If I can't, I'll try to find somebody who can. But let's stay positive. Let's say that I do find things and I feel like I can help you. So at that point, we'll start with an overview of the complete testing to be done, because we may need to do still more tests. So the test that we do initially may give us the answer, or it may open a door, and once I get in that door, I say, wait a minute, there's another door over there. We're not stopping until we turn over every stone. Remember, I said that. We're going to review the neurological findings from day 1, because you have to understand. You must understand how your nervous system affects your thyroid. You have to understand metabolically, and you must understand neurologically. And then I'm going to give you an overview of your treatment plan. That's right. I'm going to tell you what your treatment plan is going to be and what you can expect. And then we'll review your financial obligation at that time. Okay, that's the first 2 visits. Visit 1, then if I accept you, visit 2. What else do you need for your first appointment? You have to bring shorts and a t-shirt, because if I'm checking sensation, I can't do it through your skin. You have to have all your paperwork filled out when you come in, because you're going to get paperwork and I want it done. Listen, we're not doing this halfway. We're doing this to get you better. We need to get everything done. And as I said, you need company, whoever's going to be with you. Now, you've gone through this. I want to tell you a few other things about my office. Number 1, I only accept 5 new thyroid patients per month. 5. Now, there's a reason for that, which I love working with people who have thyroid issues. I actually do love it, because when they get results, it's like the whole body lights up. But I like to do other things also, so I don't have room for more than that. We work with many other conditions in the office. So 5 new thyroid patients per month. Normally the first 2 visits are $450, but if you make the appointment after watching this presentation, it's $75. You see, I'm trying to encourage you to come in. I took the time to make the video. I'm trying to make it easy for you to find in, to learn what's going on. So many people come in and they have no idea why they are the way they are. It just gives me great joy to at least let them know what's going on, right? To make an educated decision, don't you need to know your choices? Of course you do. Now, if I feel I can't help you at the end of visit 1, I can't help you, you get your $75 back. If I'm not helping you, that's fine. I put in the time, I felt I couldn't help you. But chances are, my experience is, we will have more to talk about from there. Okay, so that's my commitment. Let's talk about yours. 3 rules of acceptance. Now, I accept you, but here's 3 things that I need. You must be willing to make serious life changes. Listen, this is your life. I don't know how much time you got left, and neither do you. But if you want to get the most out of your life, you're going to have to make changes. I'm sure you know the saying, what do they call a person who keeps doing the same thing and expecting something different? Insanity. The person is insane. We're looking for sane people here who know that they're going to have to make changes to get something different. You have to take accountability for your health. Whether you got bad advice in the past, no matter what it is, it's your responsibility. You have to make the changes. And number 3, you need to understand that insurance and Medicare only pays a small portion, if anything. But my experience is that we work at plans with people, and for most people, between $200 and $400 per month, we work something out like that where they can afford to come in for care. This will all be, go over all of this with you. But here's the other question that I need to ask you. On a scale of 1 to 10, how serious is your illness? I mean, does it bother you? I assume it's bothering you a lot because you stayed through all of this. And you have to understand that a thyroid issue is a degenerative issue. Although you will have some good days and some bad days, in general, this is the best it's going to be. You understand? So on a scale of 1 to 10, how much is this bothering you? You have to ask yourself, how has it affected your relationships? Your ability to enjoy your life, your children, your grandchildren? How about your ability to work? If you're not high up on the scale of 1 to 10, with this being a problem for you, it's not going to work out here. It needs to be an issue because I'm going to be asking you to make life changes, and if the problem's not that big, why would you make changes? So I'm looking for people who take responsibility, who make life changes, and who consider what's going on a problem. I've had people here with the worst problems telling me it's about a 2. I'm like, are you kidding me? You can't get up out of bed in the morning, you can't eat half the foods on the planet, you don't have any relationships, your hair's falling out. Yeah, it's about a 2. Even though I thought they were 10, they thought they were a 2. I'm looking for people who realize how serious the issue is. So, due to time constraints, I can only take people who are really committed. And I'm looking forward to that being you if you have these kind of problems. So, the next step is action. There's my number. I want to invite you to give me a call. I want to thank you for being and watching this, and I hope, and I know you learned a lot. I hope you enjoyed what you learned. I hope that it was clear for you, and I hope that you're seeing and trusting that for you to make a change in your life, you're going to have to do something different. And I look forward to being your partner and doing those things with you. Thank you very much for listening. I'm Dr. Harry Schick.